So let's talk about the autonomic nervous system now. So with the autonomic nervous system, recall that we are deep in the peripheral nervous system here. And we're not dealing with voluntary control as we were with the somatic nervous system, but now we're dealing entirely with processes that are involuntary in nature. We'll talk about some ways that our cortex, that conscious thought, can influence sympathetic and parasympathetic divisions, but this autonomic nervous system is going to be considered involuntary in nature. One of my goals with this video is to contrast the anatomy as well as the physiology of the somatic nervous system and the autonomic. So that's where I'm going to start. So three key points of contrast that I want to make between the somatic and the autonomic nervous system. So the first of which is the effectors. So what is it that these systems affect? So with the somatic nervous system, it's voluntary. So that's going to be our skeletal muscle, right? With the autonomic nervous system, I think it's easy for us to potentially think of smooth muscle, but it's also going to be our cardiac muscle as well as glands. Another key difference between the ANS and the somatic nervous system are the pathways that these systems take to implement their effects on the effectors. So here we see a somatic motor neuron, right? This is basically going to be a motor unit that we're seeing here. So a single motor neuron and all of the muscle fibers that it innervates. But you'll see that there's no ganglia on it. So it's a single axon that's reaching from the ventral side of the spinal cord and reaching out to the skeletal muscle. In contrast, on the autonomic nervous system, what we see is a two-neuron chain. And so you're going to see both preganglionic as well as post-ganglionic neurons. And ganglionic is just the adjective for a ganglion, of course. And so these ganglion are really going to be places of synapse going from the preganglionic to the postganglionic axon. And they're also going to be a place where information is going to be transferred from one neuron to the next. And bear in mind that anytime we have communication, we're going to see a neurotransmitter released. And so we're going to be taking a look at the neurotransmitters that are released on both the sympathetic as well as the parasympathetic side of things. So the effectors, the ganglion or the chains in which they communicate. And then the third factor that I want to use to contrast these systems is going to be this idea that with the somatic nervous system, the effects were always stimulatory. It was always acetylcholine released from those neuromuscular junctions. And we never saw a situation where acetylcholine was inhibitory in nature. And with the autonomic nervous system, that's not the case, right? So you're going to see effects that are either stimulatory or inhibitory. We're going to see that it's not just acetylcholine, but in some cases, we're going to see norepinephrine that's released. As a first pass of trying to describe some of the key differences, so sympathetic, parasympathetic. Here's our preganglionic. See how it's labeling the central nervous system? So preganglionic. Here's our ganglion, and here's postganglionic. So always at preganglionic junctions, we're going to see acetylcholine released. But over here on the sympathetic postganglionic piece of this, we're going to see that norepinephrine is going to be released most typically. This is a great overview graphic. I'm going to revisit this at least once more in this video. If you can explain this to somebody else, if you could recreate this in your own way, then that would be a great way to study for this content. So let me orient you. So first of all, over here, we're looking at the central nervous system. So everything in this kind of tan region here is supposed to represent your brain or your spinal cord. So the somatic nervous system here, so as we saw before, heavily myelinated axons, they're typically traveling long distances, and they're always releasing acetylcholine. Their effects are always going to be stimulatory, and the effector organ is the skeletal muscle. In contrast, coming down here, so the autonomic nervous system, so here's the sympathetic, so fight or flight. Here's parasympathetic, rest and digest, if you will. And here is the preganglionic axon on the sympathetic side, and it's releasing acetylcholine. On the postganglionic axon, of the sympathetic nervous system, we almost always see norepinephrine released. An exception to that is going to be at our sweat glands. We don't see norepinephrine release, but rather we actually see acetylcholine there. And our sweat glands are going to be exclusively controlled by our sympathetic nervous system. We actually don't see any parasympathetic inputs there, which I think is very fitting given the role of sweat glands. On the parasympathetic side of things, so preganglionic axon, again, acetylcholine. So that's something that these two branches share in common. Acetylcholine is always going to come from those preganglionic axons. And on the parasympathetic side, we see acetylcholine is also released. One other difference while I'm here between the sympathetic and parasympathetic is we're going to see that the preganglionic axon on the parasympathetic side is quite long, and the postganglionic is oftentimes not very long at all. And so you'll notice that the postganglionic axon is going to be non-myelinated, light myelination everywhere else in the autonomic nervous system. And then for the somatic, it's quite heavily myelinated here. I also had skipped over this initially, but the adrenal gland is unique here. We're really looking at hormonal effects here, since epinephrine, i.e. adrenaline, and norepinephrine, i.e. noradrenaline, because they're going into the blood, these are hormones. And coming from the adrenal medulla, so the adrenal gland sitting on top of your kidneys, we see that one of these that branches from the preganglionic sympathetic system actually directly innervate that adrenal medulla, and as a consequence, you get that epinephrine and norepinephrine released into your bloodstream. So this scenario is a situation where you don't have a proper postganglionic axon on the sympathetic side of things. Now, to circle back to something I'd said before, I also like that this graphic is showing that the effects can be stimulatory or inhibitory, depending on the neurotransmitters that are released, the specific receptors that are receiving those neurotransmitters. Those are going to be some of the factors that become influential in that situation. So looking now at the two divisions of the autonomic nervous system. So it's not as though the sympathetic system is on and the parasympathetic is off and vice versa. They are very much in balance with one another. So while one may be dominant in a given situation, fight or flight, right, the other one is going to become less dominant. And that reverses when we are in a restful or relaxed situation. And in that case, the parasympathetic system will dominate. But it is the case that all of our visceral organs are going to be influenced by both the sympathetic as well as the parasympathetic, and they're going to have opposite effects on upon those organs. There are going to be exceptions to this, organs outside of the visceral region where we see either the sympathetic or the parasympathetic innervating. And I'll address those shortly here. So this is a nice graphic showing how the parasympathetic and the sympathetic system influence many of these visceral organs. So first of all, the parasympathetic nervous system, it's oftentimes referred to as the craniosacral division. And if you look at where these branches are coming from, we see that in fact, it is the case that we have branches coming from the cranial region and the sacral region, but nothing in between. You see the vagus nerve being a dominant force here in the parasympathetic system. Cranial nerve 10, the only one of which extends beyond the neckline, but it's going to innervate all of these visceral organs. In contrast, the sympathetic nervous system doesn't have any fibers coming from the cranial or the sacral region, but rather they're all coming from the thoracic region or the lumbar region. And so accordingly, we're going to call the sympathetic branch, it can also go by the name thoracolumbar region or the thoracolumbar division. And so some of these descriptors are ones that we have more familiarity with. I think we're all aware of the fact that when we are in a fight or flight situation that our pupils dilate, right? When we are relaxed, our pupils actually constrict. With our salivary glands, you may experience dry mouth when you're nervous or anxious. The reason for that is because they're a part of our digestive system. And if you think rest and digest with the parasympathetic nervous system, right, it's going to stimulate salivation. That's one of its roles. With the heart, sympathetic accelerates heart rate, slows down with vagal innervation. And then coming down, so the lungs, sympathetic will bronchodilate. Digestion as a whole is going to slow down anytime the sympathetic nervous system is stimulated. And because we need to be in a place where our bodies can mobilize, where our bodies have the resources that they need to potentially get out of a situation or protect ourselves, we're going to see that glucose release is going to be stimulated by the liver. You're going to see epinephrine and norepinephrine release coming from the adrenal gland, really here. Intestines, peristalsis is going to be inhibited. Secretions coming from the pancreas and elsewhere will be inhibited. The bladder relaxes. So those are some of the sympathetic effects. On the parasympathetic, to hit upon some of these, so again, heart rate will slow. The bronchi constrict with the parasympathetic nervous system when it's stimulated. Digestion is going to be stimulated, intestines as well. And the liver, rather than seeing glucose release occurring as we do here, we see that bile is released. And so bile is going to play a major role in the breakdown of fats. So again, that idea of digestion being promoted with parasympathetic domination. I'm going to turn now to talk about the fibers that are releasing these neurotransmitters. And so depending on which neurotransmitters these autonomic fibers release, they're going to go by different terms. So any fiber in the autonomic nervous system that releases acetylcholine are going to be referred to as cholinergic fibers, right? Acetylcholine, cholinergic. And any fiber, any axon that releases neurotransmitter, that releases norepinephrine as its neurotransmitter, those fibers are going to be referred to as adrenergic fibers. I think a nice way to remember that is simply that norepinephrine is also noradrenaline. Okay, so that's got that adrenaline piece to it. Again, cholinergic fibers, all preganglionic axons, and all parasympathetic postganglionic axons. The exception really are the adrenergic fibers, the ones that release norepinephrine. So most sympathetic postganglionic axons are going to be adrenergic fibers. And the exception, as I alluded to a moment ago, are going to be the postganglionic fibers in the sympathetic nervous system that are acting upon sweat glands. Those are also releasing acetylcholine. To weave those terms into this graphic that we've already seen, right? So this fiber, and this fiber are all releasing acetylcholine. And so that means that this can also be termed a cholinergic fiber, cholinergic fiber, cholinergic fiber. And then because this one is releasing norepinephrine, that's going to be our adrenergic fiber. So if you consider how diverse the influences of the autonomic nervous system are, it wouldn't seem like enough just to have two different neurotransmitters at play. So one of the ways that we can increase variability, we can increase the variety of reactions that we see in our autonomic nervous system is by changing the receptor types. And that's going to give us more specificity in certain regions of the body. So with cholinergic fibers, which release acetylcholine, we're going to see two different classes of receptors for that acetylcholine. So receptors are either going to be nicotinic or they're going to be termed muscarinic. For adrenergic fibers, which are releasing that norepinephrine, we're going to see two key classes of receptors for norepinephrine. So we're going to have alpha and beta. We actually have alpha 1 and alpha 2. And then with the beta, we've got beta 1, 2, and 3. I don't expect you to know or memorize where all of those are at this point, but I want you to have an awareness for these receptors. I would like you to be able to appreciate that acetylcholine is linked to nicotinic and muscarinic, and that norepinephrine is going to be seeking out and binding to alpha and beta receptors. I'm big on presenting you with as many different images as I can in this scenario. So sympathetic, parasympathetic. So you see those longer preganglionic fibers here. Recall that it's largely the vagus nerve, right? It's got a long way to go. So that's one of the reasons that the parasympathetic preganglionic fibers are typically portrayed in this way. So acetylcholine, preganglionic. We see nicotinic receptors here. And then with sympathetic, postganglionic fibers, typically releasing norepinephrine. And then we see adrenergic receptors, right? This is an adrenergic fiber. Here are our alpha and beta receptors for norepinephrine. And then over here, the acetylcholine, this graphic is showing muscarinic receptors here that would be able to receive that acetylcholine. So just a visual to go with what I was just describing. There's so many great pharmaceutical applications of this content here. So over-the-counter drugs, especially for colds and allergies, those nasal decongestants, what they're doing is they're working by stimulating alpha adrenergic receptors. So you hear that word adrenergic, you should be thinking sympathetic nervous system, right? And they're going to be receiving norepinephrine. And if you think about decongestants, so the blood vessels that feed your mucous membranes, they become inflamed during a cold, during flu, during any sort of a sinus infection. And so what these drugs are going to be doing is they're actually going to constrict the blood vessels that are serving your nasal passages. And in doing so, it helps to allow you to breathe a little bit better. If you look at any of the risk or warnings of most decongestions, you will see some precautions with cardiovascular conditions, hypertension being a big one. And the reason for that is these drugs are not specific to the blood vessels in your nose and your mucous membranes. Unfortunately, they're going to go body-wide since it's taken orally. And so what you're seeing here is the effects of these drugs specifically on these alpha receptors. So as an important side note, the sympathetic nervous system is the only system that is going to innervate your blood vessels. So your sympathetic system is solely responsible for controlling the vessel diameter. In other words, your parasympathetic system has no control over the diameter of your blood vessels. So that's an important point to bear in mind, and it becomes relevant in 202 as well. So to look at this graphic, you're seeing a sympathetic neuron here, norepinephrine being released. This must be a post-sympathetic or post-ganglionic fiber, and it's releasing norepinephrine on one of these alpha receptors. And so you're seeing these are supposed to represent the action potentials that are going to be firing. So here, this axon is firing at a very steady rate. In contrast, if this axon fires rapidly, so these are all action potentials, you will see a lot of norepinephrine released. And as a consequence, blood vessels constrict. And that's exactly what a drug like Sudafed is going to be doing throughout your body. So when those blood vessels constrict, that's more pressure, that's more resistance in your blood vessels. And as resistance in your blood vessels is increased, think about turning up the water going through a hose. That's more pressure on the walls of that hose, more pressure in the blood vessels. And so somebody who already has hypertension is going to experience an increase in blood pressure with intaking these drugs. Conversely, this graphic, I love that it's showing that there's a decreased signal rate now coming from this axon. So because there's less signaling, the vessel dilates. Another pharmaceutical example that you all might appreciate are bronchodilators. So they're acting on beta receptors. So again, think beta receptors. So that's going to be receptors for norepinephrine. So again, we're looking at the sympathetic branch of the nervous system here. And so with bronchodilators, it's basically exacerbating what you would see with the sympathetic response. In fight or flight, you need to be able to breathe more easily, you need to be able to have those airways open up. And so these bronchodilators are acting in that very way by attaching to these beta 2 receptors that you have dispersed in your bronchioles, also in skeletal muscle, incidentally, but and they're going to allow for bronchial dilation. And so a person who may be having an asthma attack, for example, would be able to breathe easier in that case. EpiPen, so epinephrine is going to affect beta 1 receptors as well as beta 2. So those receptors, beta 1 are largely on cardiac muscle. Beta 2 you're going to find in pulmonary regions, again, just as I said a second ago. And so because it's acting on both, you see a rapid increase in heart rate as well as that bronchial dilation. Last point I want to make in this video is to look at the big picture here and to take a step back at the levels of control for the autonomic nervous system. So while the autonomic is automatic and typically beyond our conscious control, there is some input that we see really coming from the cortex via the limbic system. You can imagine simply thinking about something that makes you nervous, perhaps a scary situation that you were in, and just thinking and recalling those events triggers the limbic system, which then communicates with the hypothalamus and triggers those downstream effects going from the brainstem that may lead to an instantaneous increase in your heart rate, dilation of your pupils, etc. Similarly, on the flip side of things, you may think about or have a smell come in of cookies or something that makes you salivate or makes you hungry. And so that would also be a situation where the cortex is coming into play, bringing in some emotions, bringing in some hunger, and you're seeing downstream effects there. But in every way, you can think about the hypothalamus as integrating a lot of this autonomic control. We talked about the role of the hypothalamus in libido, in regulating thirst, in regulating hunger. But the brainstem is going to more directly, the brainstem as well as the spinal cord are going to more directly implement the effects triggered by our hypothalamus. So for example, the brainstem is going to regulate pupil size. It's going to control your heart rate and blood pressure. Salivation, those impulses are going to have to pass through here. So I wanted to just put this up here to get you all thinking a little bit more about the big picture and the role of the hypothalamus in integrating many of these actions. So hopefully that was useful. Thanks, guys.